Hi, my name is Ariel Munitz, and I'm happy to present some of our data that were published in the manuscript entitled Epithelial Cell Expressed Type 2 IL-4 Receptor Mediates Eosinophilic Esophagitis. Eosinophilic esophagitis is a food antigen-driven allergic disease, which is characterized by eosinophil predominant inflammation, esophageal dysfunction, and expression of the hallmark type 2 cytokines IL-4 and IL-13. Clinically, EoE is characterized by a range of symptoms which vary with age, including abdominal pain, dysphagia, vomiting, and food impaction. Although the pathogenesis of EoE has been extensively studied, there is currently a lack of robust experimental models which mimic human disease. Such models could uncover the cellular and molecular mechanisms of EoE and lead to new therapies. To establish a new EoE model, we skin sensitized mice with oxazolone. After 17 days, we determined serum IgE as a marker for sensitization. Subsequently, the mice were intra-esophageally challenged with oxazolone using a modified feeding tube for an additional 18 days. Thereafter, the mice were euthanized, the esophagus obtained, and various segments ranging from the proximal to distal esophagus were analyzed. Our analysis revealed that oxazolone-treated mice displayed marked thickening of their lamina propria. They also displayed increased epithelial cell thickening and had multiple invaginations. This is shown here in the photomicrographs, but also in the quantitative analysis, which is shown on the right. As shown by anti-Ki67 staining here in brown, epithelial cell thickening was associated with marked proliferation of the basal cell layer. Furthermore, oxazolone-treated mice displayed significant eosinophilic infiltration in their lamina propria, and intraepithelial eosinophils were also largely found. Furthermore, Mason's trichrome staining revealed marked subepithelial fibrosis in oxazolone-treated mice. Collectively, these data demonstrate that our experimental EoE model mimics the major histopathological features of human disease. Next, we compared between the transcriptome signature of experimental EoE and human EoE. Experimental EoE induced the transcriptome signature with upregulation of the major type 2 cytokines and reduced expression of transcripts that are associated with barrier functions such as desmoglein 1. Strikingly, the transcriptome signature of experimental EoE recapitulated the major altered pathways that are present also in the transcriptome signature of human EoE. Collectively, these data show that experimental EoE displays marked transcriptome overlap with human EoE. Given the potential involvement of IL-13 in human EoE, we were set to determine the role of IL-13 receptor alpha-1, which comprises a receptor chain that is part of the type 2 IL-4 receptor. Our data show that following oxazolone challenge, mice which lack IL-13 receptor alpha-1 were completely protected from thickening of their lamina propria and their epithelial thickening. This is again shown here in the photomicrograph and in the quantitative analysis below. They were also protected from basal cell layer proliferation, and the proliferation of the basal cell in these mice was just like saline-treated mice, as shown here in the picture and in the quantitative analysis below. In addition, IL-13 receptor alpha-1 deficient mice were completely protected from oxazolone-induced fibrosis, as shown here in this analysis of the Mason trichrome staining, and were markedly protected from influx of eosinophils into the esophagus. Further evidence for the critical role of IL-13 receptor alpha-1 in EoE was observed by global RNA sequencing. This analysis revealed that there was no difference between oxazolone-treated IL-13 receptor alpha-1 deficient mice and saline-treated mice. Collectively, we have shown that IL-13 receptor alpha-1 plays a critical role in EoE. What we didn't show in this presentation is that the expression of IL-13 receptor alpha-1 is largely on the epithelium. So basically what we've shown, and to summarize, we developed a unique and robust mouse model for EoE that recapitulates the clinical features of human disease. This experimental model provides an excellent tool for translational studies and preclinical drug screens. EoE is primarily driven by IL-13 signaling via epithelial cell-expressed IL-13 receptor alpha-1. I wish to finish by specifically thanking Shmulik Avlas, who nearly single-handedly developed the experimental model, and to all of our generous funding agencies. And thank you all for listening.